I've had a lot of patients that have come into clinic saying, you know, I didn't know what this was. I thought maybe I was just experiencing something weird, or it was just something that I was imagining, but I truly have a disorder that's treatable. So restless leg syndrome is a syndrome that has been around for years and years. It's only been more recently that the public has been more made aware of restless leg syndrome, but it can be a very debilitating disease for patients. So restless leg syndrome is a syndrome where people will get this desire to move their legs at night. They get kind of a creepy, crawly, difficult to describe feeling that typically comes when they're resting. It typically involves their lower extremities, their legs. Sometimes though, if it's severe enough, it can affect their upper extremities. And sometimes if it's very severe, it can affect people during the day as well as at nighttime when they're just sitting to relax. Restless legs has been found to be genetic, so there's a large genetic component of restless leg syndrome. So I always try to get a family history from patients to see if any family members have described symptoms such as restless leg syndrome. We have found that restless leg syndrome is associated with iron deficiency, and so when patients are being evaluated for restless leg syndrome, we always check a level called a ferritin as well as an iron. Some patients' restless leg symptoms can improve just by replacing their iron level. Sometimes we find that patients' iron levels are very, very low and they require an IV infusion, but then in turn it can help their restless leg syndrome. Other reason why people can get restless leg syndrome is some people will have an underlying what's called a peripheral neuropathy or damage to the nerves in their legs, and it'll increase the risk for developing restless leg syndrome. And some people have just what's called idiopathic restless leg syndrome, meaning that we don't really understand or why they develop restless leg syndrome. What restless leg syndrome can do is it can cause disruption of sleep at night. And so even when people are sleeping, their legs can bother them even though that they are asleep. And they'll want to move and kind of kick their legs all night. People sometimes have told me that they have worn holes in their sheets, or their bed partner will tell me that they have kicked them all night long. And so as they are moving their legs, they are unable to sustain a deep level of sleep. And so when people sleep, they range from being awake to very deep levels of sleep. And with the restless legs, it kind of keeps them fluctuating. And so they don't keep that deeper sleep, and then they wind up being very, very tired during the day and fatigued, and sometimes can miss events or work or not be as sharp as they would like to be. We diagnose restless leg syndrome often by a sleep study. So if someone is complaining of symptoms of an kind of a difficult to describe uneasiness feeling in their leg, we will often send them to a sleep lab where they'll go in at about 8 o'clock at night, and they have electrodes placed on their head. They'll have monitors placed on their chest as well as on their legs, and they'll have a sleep study which will start from about 8 o'clock at night, usually until about 5 or 6 o'clock in the morning. And these sleep studies can monitor how much movements are in the legs throughout the course of the night. The way we treat restless leg syndrome is by medications, and the medications that we actually use for Parkinson's disease are often the medications that we use to treat restless leg syndrome. It's been found that restless leg syndrome is also associated with a dopamine deficiency like Parkinson's disease, although patients with restless leg syndrome are not necessarily at higher risk for developing Parkinson's disease or vice versa. But we will start them on Parkinson's medications, typically if their symptoms are just at nighttime. If their symptoms start while they're watching the 10 o'clock news before they go to bed, we'll often give it to them maybe half an hour before they know that they're going to sit down and relax for the night. Other medicines that we will use to treat it are the dopamine agonists such as Requip and Maripex, and sometimes we will use some of the epilepsy medications such as gabapentin and Lyrica to treat restless leg syndromes. If people are having symptoms during the day, there are also extended versions of both the Maripex and Requip that we will put them on. But it's a very treatable disease, and it's a matter of just getting into a physician that's aware of the disease and knowing how to treat it and what medications are appropriate.